Welcome back to the Hills Health Next Summit. October is Breast Cancer Awareness Month. To discuss the importance of screenings and awareness, please welcome Valerie Nelson, Manager of Federal Policy and Advocacy at Susan G. Komen, one of our sponsors this morning.
All right, good morning, everybody. I have the pleasure of speaking to you right after coffee, so hopefully you're awake. As you heard, I'm Valerie Nelson. I am Susan G. Komen's Manager of Federal Policy and Advocacy, serving the breast cancer community. Of course, with this being Breast Cancer Awareness Month, breast cancer might be on the mind for a lot of you. This time of year, you see a lot of pink ribbons, a lot of pink things popping up. And while we've made really great strides in the early detection and treatment and care of breast cancer, the fact remains that breast cancer is still a pressing public health challenge, killing more than 110 women in America every single day. That is an unacceptable reality to us, and that is why Susan G. Komen worked to launch the Alliance for Breast Cancer Policy this last spring. So the Alliance is a coalition of 30 leading advocacy organizations bringing together patients, providers, and advocates to drive forward patient-centric, evidence-based federal policy change to improve the lives of those living with breast cancer. This is really important work, and in doing that work, the Alliance is really focused on early detection work. When we can catch cancers earlier, they're easier to treat, there are better outcomes for the patient and better outcomes for our healthcare system as well. And so, as I mentioned, in doing that work, the Alliance is really focused on early detection. As you just heard, it's Breast Cancer Awareness Month in October, so this is the time of year that many women are reminded to get their screenings and get their breast cancer screenings. But still, many insurers do not cover the full range of imaging exams needed to get to that diagnosis. We're still at that point, which is why the Alliance is working so hard to drive forward the bicameral, bipartisan Access to Breast Cancer Diagnosis Act. So in this legislation, by requiring that private insurers cover medically necessary diagnostic and supplemental breast imaging without patient cost sharing, we can work towards saving lives and reducing health disparities for especially rural Americans, lower income women, Black and Hispanic women who are less likely to get that necessary follow-up exams if there's cost involved. So I'm really excited, and Komen is really excited, along with the Alliance, to be able to shed some extra light on this issue this month in partnership with the Hill. So we'll be hosting an in-depth conversation on the Access to Breast Cancer Diagnosis Act on October 22nd with the Hill to discuss not only that legislation, but also gaps in access to early detection and what Congress can do to address these pressing financial barriers for women across the country. So I hope you will all be able to join us in that work and in that conversation in a few weeks, but also join the Alliance for Breast Cancer Policy beyond October in honoring breast cancer patients, survivors, and those impacted by this disease across the country, honoring their lives and their work in bringing forward actionable policy change beyond October. So that's it. I hope to see everyone there in a few weeks. I appreciate your time.
Thanks again to Susan G. Komen for their support of today's program. For more, please be sure to scan this QR code for the Hill's Breast Imaging Show, Screening Saves Lives, on October 22nd.